Breast augmentation is basically the surgical enhancement or enlargement of the breast. This day and age is typically done with a couple of different types of implants and in a couple of different places. So we're usually talking about either putting a breast implant underneath your chest muscle or underneath your breast gland itself. For the vast majority of the patients, it ends up being something that's put underneath the muscle. It's a procedure that's done here at the surgery center. Takes us about an hour to do it, and you're here for a good 3 to 4 hours, but you go home. It's an outpatient type procedure. Recovery for most women is a relatively quick thing. It's a lot like when the milk has come in for them. It's a lot like lactation. It's a tense, tight, irritated, swollen feeling for a couple of days, and then it settles down pretty quickly. So that for most people, they're taking pain pills a day or two, and then back to work somewhere around a week would be the standard fare. Looking back to normal in the 6-week to 2-month range, seeing what the final result's going to show up somewhere around 3 months down the line. In general, very well tolerated procedure, but it usually is a full 3 months before they've seen the final result. Well, what you're putting in is actually a breast implant, which today you're using either a silicone implant, which is what this is, or a saline implant, which is the same bag just filled with salt water. Why you'd use one or another, we have to go in great detail after you examine a patient, and certain patients are candidates for one and not the other, and so that's all settled at the time of the consult. But typically it's just a silicone implant that's placed underneath their chest muscle, and it fills out the whole breast. Well, it is surgery. I mean, to start with, number one is that it's not coming to get your hair done or something like that. It's a real procedure. It has all the risks attended with any surgery, so infection, bleeding, anesthetic issues, all very low, but still very real, and we go through those in great detail when the patient comes in. The specific ones to an augmentation that we always talk about are what's involved with a foreign body, putting a foreign body in you, what's involved with having an implant in you, what special risks does that bring. It changes what an infection is, it changes things down the road, and we have to spend a good 15 to 20 minutes with each patient just covering those issues at the time of the consultation. Generally, the patients are very, very satisfied. I mean, nationwide, you look at satisfaction rates in the 93–95% range, and that I do not do any computer aided things to show you and promise you that this is what it's going to be, but I think I have enough photos of patients over the years to be able to show you that here's someone that looks like you do now, and here's what that person went to, and give you a pretty good guess as to what you're going to look like when it's all done. And then we also spend a fair amount of time just measuring you and putting you into a sizing bras that actually give you a pretty good sense of what things would look like when it's all done.